Hey squad, welcome back to the channel. My name is Mike, and on today's episode, we review pediatric vital signs. What are those correct ranges for specific age groups of children? The American Heart Association's Pediatric Advanced Life Support program provides guidance on what normal vitals are for kids depending on their age. Before we continue, be sure to answer that question of the day in the comments below. How many babies have you personally delivered in the pre-hospital setting? Now let's jump over onto the computer and check out the guidelines for these pediatric vital signs. All right, squad, now that we've moved over to the computer, let's break down the vital sign, the normal vital signs for these particular age ranges. And like I said, everything is based on a mean average in years for these specific age groups. So we have neonate, birth to 1 month, infant, 1 month to 1 year, toddlers are 1 year to 3 years, preschoolers are 3 years to 6 years, school age children are 6 years to 12 years, and then adolescents are 12 years to 18 years. So yes, typically you would think adolescents 12 to 18 years, teenagers, adolescents, but some pediatricians actually go not just by the years of adolescence, but they treat them via the signs of puberty. Okay, and that pretty much means that when they start seeing signs of puberty development, breast development, deeper voice in boys, signs like that, they actually start treating these children as adults, so adult doses in medications and such like that. So depending on your area, you guys might treat in years. Everyone is a child until they're 18 years old and they get treated under pediatric protocols, or sometimes the doctors in the medical direction give you leeway and say if there are signs, visible signs of puberty, then give them the adult doses or call med control for a discussion. So just remember, everything is broken down due to age. All right, so let's start moving into our columns here. We're going to start with respiratory rate, and the neonate and the infant, according to PALS, have actually the same respiratory rate, and that is 30 to 53 or 60, depending on which text you read. The new PALS that came out in 2016 actually has the 30 to 53, but you'll also see some studies and publications with the 60 breaths per minute. All right, moving right along to the toddler, we have a range of 22 to 37 breaths per minute, preschoolers 20 to 28. And what you guys will start to see is as these children are growing, our vital signs begin to normalize. So by the time that they are adolescents, they pretty much have the normal adult range for blood pressure and heart rate and respiratory rate and so on. So for school age, these are where my children are. You have 18 to 25. And then finally, like I said, they begin to normalize, and you see that normal 12 to 20 breaths per minute. And this correlates with the adult vital signs. Okay, so moving on to heart rate. In the neonates, you will see the highest heart rate. Now, PALS actually breaks it down to awake and asleep. So we will do that as well. The awake heart rate is anywhere from 100 to 205 beats per minute. And the asleep is 90 to 160 beats per minute. In your infant, you're looking at 100 to 180 for awake and 90 to 160 for asleep. For your toddlers, you're going to be 96 to 140 for awake and 80 to 120 while they're sleeping. For the preschoolers, again, we start to see that normalization, right? 80 to 120, not as normal as you'd like, but we're getting there. 65 to 100 beats per minute for their asleep rate. School age, 75 to 118. And then for their asleep rate, 58 to 90. Okay, and then finally, when things start to normalize, you see that normal 60 to 100 while they're awake, and then that 50 to 90 beats per minute while they're asleep. So everything is starting to normalize here. Remember, these are the adult rates that you would see for a 26-year-old, or the normal rate you'd see for a 45-year-old. Okay, so moving on to blood pressure, I broke it down into systolic and diastolic numbers because they do have some ranges, but we're going to start off with that neonate. Okay, so you're going to start to see very low blood pressures for these infants and neonates, and then the blood pressure progressively increases as time goes on and these kids get older. So we're going to start with the neonate. You're going to see a systolic blood pressure of 67 to 84 and a diastolic pressure of 35 to 53. Okay, then moving on to the infant, you're going to see 72 to 104 systolic and a diastolic of 37 to 56. For the toddlers, you're going to see an increase again in 86 to 106 and a diastolic of 42 to 63. Now remember, guys, these numbers are really odd, but they're law of averages based on the studies that the American Heart Association did. And remember, these numbers are directly out of PALS algorithms. So I'm not just pulling these numbers out of thin air here. So for the preschool child, remember the 3 to 5-year-olds, you're going to see 89 to 112 systolic and a diastolic of 46 to 72. For the school-aged, again, both my children are in this category. You're going to start to see 97 to 115. Remember, we're now starting to get into normal ranges for adults. 57 to 76 for a diastolic. And then lastly, the adolescents, remember, this is where we want to shoot for as we're an adult, is that normal 110 to 130, that nice round number of 120, as everybody says, and then 64 to 83 being that number where we get 120 over 80 for the adults. Okay, so as we start to get older, our blood pressure, our heart rate, and our respiratory rate all start to either increase or decrease. With the respiratory rate and heart rate, they decrease. With the blood pressure, we increase it. And we finally get down to our adult vital signs down here, which are the ones that you guys should see and go, hey, I recognize that. That's it for today's video, guys. Thank you for watching, and I will see you guys in the next video.